Well, good evening, everyone, and welcome to our special Just for Kids presentation tonight. I'm Amy Lynn. We are teaming up tonight with Niswonger Children's Hospital to talk about vaccines, including the COVID-19 vaccine for children. Over the next 30 minutes, we will be sharing some important information on how to best protect your children. Now, this is a call-in show, so you can call that number at the bottom of your screen with your questions. And your questions will be answered by our experts this evening, and we want to go ahead and introduce them now. We want to welcome Lisa Carter, Chief Executive Officer of Niswonger Children's Network, and Dr. Heather Champney, who works in Pediatric Emergency Medicine at Niswonger Children's Hospital. And ladies, thank you so much for joining us tonight.
Thank you. Thank you.
Certainly a very important topic, and I know we're going to get a lot of phone calls here talking about vaccines and our kids, and of course this time of year with Thanksgiving passing and now coming into Christmas. Let's just sort of start there and kind of what we're seeing as a community and what you guys are seeing now in the hospital system.
So we have been seeing for quite some time a lot of viral infections come into the hospital, especially as children come in, and we've seen that all throughout the summer. Unfortunately, over the past few weeks, we are seeing an increase in COVID-19 cases across the board. Today, as a health system, we had over 200 patients hospitalized with COVID-19, and that, again, has increased over the past several weeks. We got down into the 140s, the number of hospitalizations, but as cold weather came in and people started moving inside and having more indoor activities, unfortunately now we're seeing more viral spread.
And of course seeing the holidays and people getting together more, and that trend I'm sure will continue over the next few weeks. What are we seeing in the pediatric areas?
So this summer we really started to see an uptick in some of what we think of as our typical winter viruses like RSV and parainfluenza, which oftentimes causes croup. And we started noticing just as a group that we were seeing these during the summertime, which was unusual for us. And that's probably because people were starting to unmask and be together a little bit more. And then certainly as they've gone back to school and everyone has had more communal time together, we've just seen a continual uptick in basically all of those typical childhood viruses. And recently we have started to see the flu come back in. So in addition to RSV and rhinovirus and those other things that are typically circulating, we now have the flu starting to circulate. So it's all here. It's all arrived.
Yeah, definitely starting to see those cases. And one of the things, we're obviously talking about COVID-19, the vaccine readily available. We have all been vaccinated, and so not wearing our masks right now, socially distancing, and that's that message that we continue to see. The COVID-19 vaccine and our children, what are we seeing for our area, and why is that vaccine so important for those 5 and up?
Well, first, it's really wonderful and exciting that we finally have that vaccine. We know that vaccines in general work. They work to help us protect our children and protect ourselves from all of these communicable diseases. Vaccines in general work as like a primer of the pump, so to speak, for your immune system. It just tells the immune system, here's this thing that could present itself, and here is how you can fight it. And so that pump is primed when you're vaccinated against a variety of illnesses. And so being able to vaccinate our younger, more vulnerable populations from this terrible disease is incredible. It gives us another tool in our belt to help combat this pandemic.
And Lisa, what have you seen so far with the COVID-19 vaccine and our children in this community? I know we saw that first child get their vaccine, and we saw those lines, and there was that initial rush to get the vaccine. People were really excited about it. Where are we now with the vaccine?
Sure, and we did. We saw an initial rush, and those were people who really had been waiting on the vaccine and waiting on that age to change so that kids could be vaccinated. And unfortunately now we've seen that drop off. in children and in adults. Unfortunately, our area of the state is lagging as far as the statewide numbers, and then our state in general is behind even the nationwide numbers. We haven't reached 50% vaccination rate in this area. We're hovering in the mid 40% overall for the population. And so we know that contributes then to what we're seeing from the health system side with increased hospitalization and increased admissions, especially related to COVID-19.
So it all kind of plays a part in that overall picture.
It all plays a part, yes.
And for parents who are watching, because I know a lot of parents, you know, maybe on the fence, not sure what to do, your advice to them when it comes to the COVID-19 vaccine and what you've been seeing in the hospital.
Well, first of all, your primary care provider is your best source to go to for information. So I strongly encourage you to have a conversation with your primary care provider about this vaccine and any other things that you have questions about. That being said, I mean, I 100% endorse getting the vaccine. All of my children have it. 2 of them are younger, so they have just now been able to complete that vaccination series. And so in terms of safety, and that's what a lot of people are concerned about, vaccines have been researched for years, for decades. There's tons and tons of data that confirms vaccines work and that they are safe. And that goes for this vaccine as well. There were clinical trials long before any of the emergency use authorizations came through to prove that not only did they work, but they were safe, and that the side effects were pretty common side effects for all vaccines, and that severe side effects are very rare. And we know that they are still more rare than they are still worse. They're still better, excuse me, than if you get the actual infection. So those vaccine side effects are really pretty minimal when you're looking at the general risk of getting the disease.
Well, we have certainly made a good start into the evening, a lot of useful information. We're going to continue our conversation here in just a minute. Again, we are talking about the COVID-19 vaccine and kids tonight during our Just for Kids broadcast. Officials with Niswonger Children's Hospital here to answer your questions tonight. Just call 1-888-903-9545. We have people standing by to take your calls, and we're going to return after this short break. Stay tuned.
I'm Paul Mullins. This is my wife, Lori.
We decided to get the COVID vaccine to protect our daughter, Hadley. She is in active cancer treatment for leukemia. She's never still. She's
very entertaining.
Entertaining, energetic.
She loves to sing, loves to dance.
Individuals that haven't received the vaccine, we would encourage you to do so, again, to protect yourself and protect your children.
We want our children to stay in school, for our people and businesses to thrive,
to worship with family and friends,
and most importantly, so another person does not have to die from this disease.
I got my COVID-19 vaccine to protect our community.
The vaccine is safe, free, and highly effective. Talk to your doctor.
Protect yourself, protect your family, protect your neighbors.
We are all counting on each other.
I chose to get vaccinated.
Well, welcome back to our special Just for Kids presentation tonight. We are talking about the COVID vaccine, protecting our children and protecting our communities. If you have questions for our panel, once again, you can call 1-888-903-9545. We are starting to take those questions, and they are coming in just as fast as we can take them, and we're going to get to those viewer questions right now. First one coming in is from a parent of a 5-year-old that is watching tonight and says she does want to get her child vaccinated, and says she's actually talked to her pediatrician. They've had that conversation, but they're not offering the vaccine. So wanting to know where the vaccine is available in our community.
So there are several locations throughout the region where you can find vaccines. Ballot Health offers a service at the mall in Johnson City, and then there are several pods throughout other communities in the region, and all of that is posted on the Ballot Health website. You can also go to a variety of drugstores, Walgreens, CVS, all of those locations. Easy to find on their websites, the hours of availability and the times that you can sign up to go and make an appointment to get a vaccine.
All right, and our next question also from a viewer talking a little bit about COVID-19 and the safety of the vaccine for children, wanting to know, do we know about the companies that have manufactured those vaccines and what we know about them?
Sure. So right now there are 3 vaccines that are available for use, and they have different age ranges that they're approved for. So there's a Johnson & Johnson vaccine, which is a single dose, and that's still for adults. Moderna has a 2-dose vaccine that is currently for adults and is in the process of getting approval for adolescents and the younger populations. And then there's the Pfizer-BioNTech that is the vaccine that we're really talking about tonight. So that's the first one that had emergency use authorization for adolescents and is now what we're using for that age 5 to 11. That dose for the 5 to 11-year-olds is about 1/3 of the dose that's given to the adolescent and adult population. And in those studies, they showed that that 1/3 of a dose was just as much of an immune booster as the adult dose, and that these pediatric patients mounted quite the response from that dose. So they are safe, they're effective, and they're a smaller dose based off of their age.
And Lisa, when it comes to the vaccines and what we are seeing, when the communities make sure that it is readily available, and it sounds like community leaders are speaking out and really endorsing to kind of bring peace of mind as well to protect the overall school population and what we're seeing.
Oh, sure, and it's so important as a community that we come together collectively and really support the vaccination. You know, Dr. Champney was talking earlier about just vaccinations overall and how safe they are. I remember when the vaccine for chickenpox came out, and that was when my children were younger, and I was so excited because I remember having chickenpox as a child, and that was not fun, and so they did not have to do that, and we've seen that through the years. So many illnesses are preventable, and it's because of the science and the information that's available for vaccines.
And of course, we did wait longer for the pediatric version of the COVID-19 vaccine, those trials that were underway. You talked a little bit about the testing that was done for peace of mind for parents that might be out there.
Yes, I mean, there are thousands of children enrolled in these trials, and there are ongoing trials where they are continually surveilling responses, risks, and all of those sorts of things. So it's a continual process. It's not a, oh, we've finished it and now we're going to move on. They're constantly looking at the data and tweaking things as necessary.
And one of the things we were talking about is just, do kids, are they at risk for COVID-19 and at risk of getting really sick from COVID-19? And of course, you know firsthand what can happen.
Yes. So yes, kids are at risk for getting pretty much any infectious disease. They are definitely at risk for getting COVID-19. I think early on in this process, you know, 1.5 years, 2 years ago, we weren't quite sure, we weren't positive if they were going to be negatively affected by this virus, but we know now that that is the truth. They can get the disease and they can have really poor outcomes from that disease. Fortunately, children just in general tend to be more resilient, and they tend to not have particularly bad outcomes if they are in general healthy kiddos. But yes, they can get sick, they can have long-term really poor outcomes, they can die from COVID just like they can from other infectious diseases. So yes, children can get it, they can get really sick, and they can die.
And I know when we were going through, and we continue to watch every case that was coming up, and we had that second wave where those numbers just continued to climb, and even in the pediatric numbers, for the first time, we saw pediatric numbers on the board, and they were increasing, which means they were pretty sick to be admitted into the children's hospital.
Oh, sure, and we saw that with the Delta variant, and you know, we talk about viruses, that's what they do. They have mutations, they change. We're seeing that now. Unfortunately, we have another mutation that has come about and another variant of the virus, and so a lot of unknowns about that and how infectious it will be, how severe the illness will be. But that is a normal pattern that viruses go through. And what we saw with the Delta variant was unfortunate unfortunately different from the very original strain, because it did seem to affect kids differently, and that's when we saw obviously increases in hospitalizations for adults and increases in hospitalizations for children. It was much more infectious, and that was one of the primary things with that, is it was because that variant was much more infectious than what we had seen with the original strain.
But what we have seen over and over is that regardless of the variant, if you are vaccinated, you have a significant reduction in your risk of hospitalization and negative outcomes. Like 95% risk reduction of a poor outcome if you've been vaccinated and you still get the disease. So it just because it mutates and just because we don't have 100% pure protection doesn't mean that we shouldn't get the vaccine, because it most definitely keeps us out of the hospital, keeps us from having those negative outcomes.
Even with those different variants?
Even with
Absolutely.
those, yes.
All right. Well, we are talking about the COVID-19 vaccine and protecting our kids tonight during our special Just for Kids broadcast. Call 1-888-903-9545 with your questions. Officials with Niswonger Children's Hospital here to answer those questions. We're going to return after this very short break.
COVID-19 still poses a serious threat to our community, including kids. Here in the Appalachian Highlands, more than 25% of positive COVID-19 cases are under age 18. And nearly 95% of hospitalized COVID-19 patients are unvaccinated or only partially vaccinated. The best line of defense is the COVID-19 vaccine, which can prevent serious illness and help save lives. Don't delay. Get your COVID-19 vaccine today.
We want our children to stay in school,
Our businesses to thrive,
to practice our faith in fellowship,
and most importantly, so another person does not have to die from this disease.
I got my COVID-19 vaccine to protect our community.
The vaccine is safe, free, and highly effective.
It's your decision. Talk to your doctor.
Protect yourself, protect your family, protect your neighbor.
We're all counting on each other.
I chose to get vaccinated.
All right, welcome back. We have been getting a lot of phone calls tonight, a lot of questions. We are getting to as many of them as we can. But once again, here is that number. If you do have a question, please call this number now. We are joined right now this evening by Lisa Carter, the Chief Executive Officer of Niswonger Children's Network, and Dr. Heather Champney, who works in Pediatric Emergency Medicine at Niswonger Children's Hospital. And we're going to get right to these questions so we can get as many in. This one has a granddaughter who has already had her first shot. She takes allergy shots twice a week and wants to know if she can have that second dose on the same week as she has one of her allergy shots, or if she should wait.
So again, I would recommend that she talk to her allergist and make sure that there's not any specific contraindication, but really we can co-vaccinate lots and lots of things. So I would encourage her just to reach out and clarify that that's okay, but there shouldn't be any issue with that.
Okay. And our next one, the vaccine is 1/3 of the adult dose. We talked about that earlier tonight. What happens if the child is larger in size than the age? Is that still effective? So when we talk about, cutting down to that 1/3,
sure,
how does that compare with the child size?
So we worry about, in pediatrics, everything is based off of weight, okay, when we dose medications and that sort of thing. But when we're looking at vaccines, that's a little bit different process, because we're not asking the entire body to take this medication in and do something with it. We're asking the immune system, which really is sort of independent of the weight, so to speak. So we're not worried about a weight-based dosing for vaccines, especially in that younger age group. We're really just, like I said before, priming the pump of that immune system, which is not really directly related to their body mass index or anything like that. So again, it'll work.
So it'll be good.
Yes.
How about if a child has had COVID at age 8, how long do they want to wait in order to get vaccinated? If they had COVID, how many days do they have to wait before they can get vaccinated?
So if you're out of your 10-day isolation and you no longer have symptoms, you can get vaccinated. If for some reason they receive some other kind of treatment like a monoclonal antibody or plasmapheresis, they need to wait a full 90 days to get vaccinated. But in that age group, that's not something that's been offered pretty frequently. So if that child is otherwise completely healthy, not on any other medications and that sort of thing, as soon as they are out of isolation, they can get vaccinated.
And I would imagine we see a lot of those cases where unfortunately they had COVID and now know they do not want to get it again.
Right.
So a little bit in hindsight perspective perhaps.
Exactly.
What is the 10 to 15 year effect for the children? Are there scientific studies that have been done? Obviously concerned for the long term and what we're seeing when it comes to the safety down the road.
So no, because we haven't had this specific disease for 10 to 15 years. So we have not had the length of time to collect that data. Now, we have had plenty of time to collect data on how other vaccines work and how they affect us just in general. And we see that we don't have negative effects, long-term negative effects from these vaccines. So specifically, people are concerned about fertility, both male and female fertility. It does not affect fertility. It does not seem to have any sort of long-term negative sequelae. And obviously we're continually gathering that data, and we change as we get new information, just like with anything. As we get new information, we will modify our process as we need to. But at this point, we don't have 15 years of data for this specific virus. So.
And of course, the studies have been done talking about how the risk certainly outweighing when it comes to the safety that the vaccine can provide, especially for children who might be immune compromised.
Sure, and this type of vaccine, I mean, the vaccines overall are studied for years, and so then it is how do you tweak that to respond to a certain virus. And so it's not like they started from scratch in building this vaccine. The method and the science behind the vaccine has been available for many years.
Yes. All right, we are going to take one quick break. We have just a few minutes left in our special broadcast. Again, we're discussing vaccines and our children and keeping them safe. This is your last opportunity to give us a call. The number right there on your screen. We're going to return after a short break to answer a few more questions.
I'm Paul Mullins. This is my wife, Lori.
And we decided to get the COVID vaccine to protect our daughter, Hadley. She is in active cancer treatment for leukemia. She's never still. She's
very entertaining.
Entertaining, energetic.
She loves to sing, loves to dance.
Individuals that haven't received the vaccine, we would encourage you to do so, again, to protect yourself and protect your children.
COVID-19 still poses a serious threat to our community, including kids. Here in the Appalachian Highlands, more than 25% of positive COVID-19 cases are under age 18. And nearly 95% of hospitalized COVID-19 patients are unvaccinated or only partially vaccinated. The best line of defense is the COVID-19 vaccine, which can prevent serious illness and help save lives. Don't delay. Get your COVID-19 vaccine today.
Well, we are entering the final minutes here of our Just for Kids special. Our topic again, COVID-19 vaccine and our children. The number still remains here at the bottom of your screen. We're going to get to a few last questions that we have, and we have a big pile. So a lot of questions coming in. This particular parent has a 6-year-old boy with autism and said that some of the vaccines talk about maybe some side effects there, and she is wanting to get any kind of advice on that particular case.
So if she's asking, do vaccines have an association with autism, the answer is no. That is, one of those myths, those kind of false information that spread like wildfire on the internet. So no, there is no correlation between autism and vaccination. Now, children with altered sensory processing, executive function, oftentimes will struggle with just the process of getting the vaccine, and that's more of a process sort of thing and not directly related to the vaccine itself. It's that touch of the body and that sensory input. So I would strongly encourage her just to talk with her pediatrician, and if they're offering it in that office, they have ways of calming the child and helping them through the vaccination process, and just to talk with their primary care.
Okay. This one hasn't had the vaccine yet because the child is scared of the long-term effects. How do we know that it's actually going to help more because he is worried about others and hearing stories and things like that? So a little nervous about getting the vaccine.
So as Dr. Champney has said, we really encourage parents and even children if they're old enough to have those conversations with their physician, with their pediatrician, to really talk through those things. And we have not seen, again, as we have said, the side effects of the vaccine are much milder than the disease and the illness itself. And so really evaluating the risk-benefit, the risk to the vaccine is extremely minimal. You know, some site tenderness and pain, very short-term fever, aches and pains, those mild side effects that usually come with some vaccines. But unfortunately, what we've seen with some of our COVID cases is much more severe.
Okay, and this one talking about the third dose for children from 12 to 18. We're seeing those boosters now, obviously for adults, wanting to know if we're going to see something from that 12 to 18-year-old with the third dose.
So it has been approved that anyone who is 6 months out from their second dose of the COVID vaccine, so that includes that 12 and up age range, can receive their booster vaccination at this point. That was just recently in the last few days changed. So prior there were some stipulations as to who qualified, and now it's been opened up to anyone who's had the vaccine. If you're 6 months out, then you can receive your third booster.
And Lisa, you mentioned the website, great source of information.
Yes.
For all of that information. There's so much that's coming out and changing, and I know you guys keeping up with all of that.
Sure, great information on the Ballot Health site. Also, I encourage people to visit the Tennessee Department of Health website and also the Virginia Department of Health website. Lots of information about infection rates, positivity rates, all of those things that are happening throughout both states. So please visit those sites as well.
Okay,
and the American Academy of Pediatrics actually also has a great website that is geared towards parents, and that might help the mom who was talking about her concerned child, kind of help guide those conversations with developmentally appropriate language and visual tools and those sorts of things. So I encourage you to also check out the American Academy of Pediatrics website.
Yeah, communication is so important, and just having those conversations and looking at the website, talking to your pediatrician like you had mentioned. This one talking about girls, and this particular mom is worried about any long-term reproductive issues with young girls. Are we hearing anything? Do we have any research or data on that?
So just like with all vaccines, that's been thoroughly researched, and the American Academy of Pediatrics, the American College of Gynecology, as well as the American Academy of Family Medicine all recommend that adolescent girls and young girls ages 5 to 11 receive their vaccine, and that there is no risk of future issues with fertility. There is just simply no risk. That's one of those myths that's kind of floated around and gathered fire because it's something that scares people, but it's not really founded in truth.
And also pregnancy. We've talked a little bit about that, but starting to see, you know, pregnant mothers and having that opportunity to go and have that vaccine.
Yes, if you are pregnant, get vaccinated. It is pregnancy and COVID is a really horrible combination. There are terrible, terrible outcomes if you are pregnant and you get COVID for you and for your baby. So please get vaccinated if you are pregnant. Yes, and breastfeeding.
And we have about 30 seconds left. Lisa, you're kind of last minute kind of summing things up for us.
So just one final thought. I know we've talked a lot about COVID, but I do want to really talk about flu. We are seeing flu also in our region, and we're seeing flu A in particular. So please, when you think about vaccinations, also consider taking your flu shot as well.
All right. Thank you, ladies, both so much for your time tonight. An important conversation, and thank you for joining us. And for our Just for Kids special thank you to Niswonger Children's Hospitals, Lisa Carter and Heather Chapney.